Doreen 𝗂𝗓𝗓 is the
Dr. Doreen is an expert in autism.
Doreen 𝗂𝗓𝗓.
Dr. 𝗂𝗂𝗓𝗓.
Dr. Doreen 𝗂𝗂𝗓𝗓.
Dr. Doreen 𝗂𝗓𝗓 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Today is my 9-year-old has debilitating anxiety.
Yep.
And it's tearing our family apart. They don't ever want to leave the house. Everything is a battle, and I can see that they are genuinely terrified. Is there any hope?
Yeah, that's so difficult. And first of all, let me just congratulate this parent for actually recognizing that there's anxiety.
Yes.
Right? I mean, a lot of times people don't even recognize that what the individual is going through is anxiety, right?
Especially in a 9-year-old. I think people
Especially
just
in a
discount
9-year-old.
it and go, you know, no, we're going to go and get over it.
Yes, yes, that's very true. With children in particular, we tend to kind of just ignore it more. And also, when there's another diagnosis, like autism, which tends to overshadow everything, right? And so people become very focused on the autism and tend to blame everything that's going on the autism, which isn't, a lot of times is not the case. And that's the thing about autism that I find interesting, is that if you break down kind of, you know, I always used to tell parents, don't focus on the label, just focus on the child or the individual, and just divide up, like, what are the issues, and try to deal with each of the issues. And often, one of the issues is anxiety with people on the spectrum. And that completely, first of all, makes sense to me, if you think about it, because we're talking about, you know, if you, Shannon, you always say, like, perspective taking. Like, for a moment, if we put ourselves in the shoes of someone who experiences some of the symptoms of autism, you will develop anxiety. First of all, a lot of people on the spectrum will have issues with sensory input, right? So lights might be too harsh for them, or sounds might be very jarring, or, I mean, we startle with certain sounds. So think about if you were hypersensitive to various tones of sounds, how much you'd be on edge, right?
Yeah.
Same thing with continued lights, right? Like lights that are too harsh for you. That type of thing will just physiologically, not just mentally, but physiologically keep you in an anxious or, you know, kind of on edge type of feeling, and that's the state that you'll be in. And then, of course, if you think about also our sensory issues, that, like, for instance, a lot of folks that we work with have issues with visual input, so they have a hard time determining, like, for instance, how is this person feeling towards me? Are they happy towards me? Are they angry? Should I be suspicious of them? Can I trust them? Like, we don't realize how much we depend on our own ability to read people, right? And that is something that's very difficult for folks on the spectrum. And so that in itself also adds to the anxiety, or even just seeing stimuli, you know, like recognizing stimuli. This is one of the biggest challenges I have right now with a little guy that I'm supervising, is just getting him to be able to focus on the appropriate stimuli. And he definitely has problems with that, and that is what is affecting his learning or his ability to thrive in society. So there's a lot of reasons why someone on the spectrum would experience anxiety. Now the question is, what do we do about it, right? Yeah. And so first I'm going to talk about kind of like just for individuals on the spectrum, and then a little bit of just giving you advice in regards to, there are lots of techniques that cognitive behavioral therapists, so psychologists who are trained in CBT or cognitive behavior therapy, they have a lot of really good techniques. I'm not going to go into them because that would be the rest of this hour today. Yeah. But if you guys are interested in looking at some of those cognitive behavioral techniques, I actually did a series on anxiety on my TikTok.
Yes.
And so every episode, every like little recording is about a different technique. And there's like 10 of them that I go through on that channel on TikTok, Ask Dr. Doreen. So you can go there and maybe some of those ideas will help you. And sophisticated ideas that are being used these days in psychology with, psychologists. Now, for individuals who are also on this spectrum, I think it's really important to just break it down, just like I said before. If it's someone where their sensory issues are contributing to their anxiety, let's try to help fix that, or give the individual a tool that's going to help them overcome that or deal with that, right? So for instance, a lot of kids do really well when they have the ability to put on noise canceling headphones. Because that shuts out a lot of the kind of jarring or sudden noises that are bothering them. That's one, you should give your child tools that they can use. It's funny because I know individuals who are not on the spectrum who also do this, right? There was a whole phase, if you guys remember, I don't know if it's there yet, I think it is, but like teenagers walking around with their hoodies, with their hoods up, and like with headphones. Why do you think they do that? Yes, they think it looks cool, but it's also a way to shut out what they think is like people looking at them, right? So
and only let in what you choose to let in, to be in control of that.
Correct, absolutely, because control is a very big part of anxiety or overcoming anxiety. And also, of course, if you have your child, if your child is able to begin using their headphones as a tool, then they can also use it in a way to help calm themselves or soothe themselves. They can listen to, when they see themselves, when they feel that they're getting hyped up, they can use, soothing music, calming music. On this flight back from the Middle East, I couldn't sleep and I was exhausted. Like we were talking past 20-something hours that I hadn't slept. And the only thing that was tolerable to me at that time was meditation music, right? And that's what I mean. Like there are certain stimulus inputs that can be very calming and can help us through moments that are anxiety provoking. So that's one. It's like headphones like that. Or a lot of kids I've seen also used to, and I don't know if it's prevalent anymore, but it used to wear tinted glasses, right? And the tinted glasses are amazing at that. We don't use them enough, I think, honestly, but they are really amazing for helping reduce stimuli that are coming in. In fact, for people now, I just learned, because I'm at that stage where you have difficulty driving in the dark, they actually give you tinted glasses.
Oh, I need those.
Yeah, which really help, which is really strange to me, but they truly help. So, just, things that help you reduce the stimulation. Now, of course, with a lot of kids, anxiety becomes very apparent when they're taken to places that are like loud or like parties. Let's say you want to take your child to an event or a party and it's overwhelming. Any kind of gradual introduction to that preparation, any kind of preparation is always going to be useful. This I learned from a teacher 100 years ago, where basically if you can expose your child, just give them information about it, practice it, whatever the situation is. I think I even talk about this on one of the TikTok videos, which is like, what are some highly anxiety-provoking situations? Let's say going to the doctor. That's something, or getting a shot, or getting blood drawn. All of those things are very anxiety-provoking for all of us. And if you can desensitize your child by practicing approximations to that, I've talked about that quite a bit, because the main behavioral technique, purely behavioral, not cognitive behavioral, but very behavioral technique that people use is for anxiety and for phobias as well, is systematic desensitization, which is this process where you essentially gradually expose the individual to the thing that is provoking anxiety. So let's say it's dogs, right? Someone's afraid of dogs, or they have anxiety when they're going to a place where dogs might be. A lot of kids who don't want to go out, there's a reason for it. Like this individual, you need to find out, is it specific stimuli, like animals, cars, strangers? Is it noises, or is it lights, or what else is it? Because then you can produce a series of stimuli that are progressively more, similar to the exact object. So let's say it's dogs. If I'm producing a hierarchy, I would first have like the individual sit in front of, let's say, a picture of a dog and see if they can handle that, right? Just a flashcard of different dogs. And if they can't, and if they start to become anxious, then I would help them pair that, like having the picture together with breathing exercises or thinking of a pleasant place that they could be, or calming music, something that is the opposite of anxiety provoking. And so then the next stimulus might be a video of a dog on TV. And the next one, which now introduces also the sound of barking. And then the next stimulus might be like going to a pet store, looking at dogs from behind glass, and so on and so forth, until the actual final stimulus is, you know, going up and touching a large, scary-looking dog, right? And all of those stages need to be paired with something that is contrary and relaxing. So that's kind of the behavioral way we deal with it. But for me, when you have a child who has anxiety, the first thing I do is I try to identify all the different stimuli that are causing the child anxiety. And sometimes with individuals who are like less affected by autism and much higher level or higher functioning, the anxiety might be something that is too internalized and too deep to deal with. For example, some of our folks who have kind of recovered from the syndrome, right, no longer qualify for a diagnosis, still struggle with anxiety, and a lot of it is social anxiety, because they are uncomfortable still with being in public, because they feel they're being judged. They feel like, you know, people, I just learned this recently from one of my previous patients who's recovered, that a lot of the stuff that goes on in ABA, where you are learning to do something, you know, what is right and what is wrong, do this, don't do this, can over time lead to feeling like, you know, scared of making a decision, or I don't want to be wrong, I don't want to do the wrong thing. And those types of things are also increase in anxiety. So for me, I am a big supporter of getting everything to help the child. And behavioral treatments, cognitive behavioral treatments, but also very, very important, medication. And we're very, very lucky that we have excellent and lots of different medications that help with anxiety. These are called antidepressants because depression and anxiety both are controlled by the same neurotransmitters. And so the medication happens to be the same exact medication. Some are a little bit better at dealing with anxiety than depression and so on, but it's always the same stuff. And they're usually called selective serotonin reuptake inhibitors, or serotonin norepinephrine reuptake inhibitors, so SSRIs you might have heard, or SNRIs. And these are really, really effective. And they don't change the personality of the individual. They really, truly don't. They just take kind of the edge off, and they allow the individual to just feel more comfortable, I would say, in their own skin, and in social situations, and in situations where they would normally be falling apart from the anxiety. So the summary of all that is, you know, medication does help, and all the literature shows that a combination of medication and cognitive behavior therapy or behavior therapy is the most effective. And that's what I would do.
Wonderful.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.